Morning. Welcome back to Open Med School. This is part of Cardiology Complete. Basis of Cardiology for undergraduates based on Davidson. So now we look into the gross anatomy of the heart. You can see that the left ventricle is thick-walled, approximately 10 millimeters in thickness, and the right ventricle is thin-walled, around 3 millimeters. And you can draw the atria like this. This is the atrioventricular valve, and here is the aorta, and aortic valve is continuous with the mitral. So this is how you draw the picture. Basic anatomy of the cardiac structure you should be able to draw. And in a chest X-ray, you should be able to identify the normal structures. So this is the cardiac salute on chest X-ray. On the right side, in the upper part, there is a superior vena cava, and here predominantly the right atrium that is contributing to the right border. On the left side, here comes aortic knuckle, aortic arch, pulmonary conus, left atrial appendage, and the left ventricle. And this is the basic cardiac salute you should be knowing. So this is one more, little more enlarged picture. You can see this is on the left side. This is the aortic knuckle, the main pulmonary artery, pulmonary conus, the left atrial appendage, and here the left ventricle. So the structures comprising on the left side, you should be thorough, because when you say patient with mitral stenosis, it is this region that becomes prominent. So that is the importance of knowing that. And on the right side, it is predominantly the right atrium comes here, and part of the superior vena cava on this side. Hope the cardiac salute is, and you should be able to draw the picture also. So now we go on to the basic blood supply of the heart by the coronary arteries. So the coronary circulation, again, we should remember that it has got heart has got a right coronary and the left coronary artery. The left immediately on origin divides into an anterior descending artery and the left circumflex artery. The right coronary artery descends posteriorly through the interatrial septa, atrioventricular groove, not the interatrial septa, through the atrioventricular groove, and it usually continues in the interventricular septum as the posterior descending artery. The artery that forms the posterior descending artery is called the artery of dominance. So if the right coronary artery continues as the posterior descending artery, it is right coronary dominance, and if the left circumflex is continuing as the posterior descending artery, or it crosses this region is called the crus, and it is passing down the interventricular septum, then it is the left coronary dominance. So right coronary artery supplies the right atrium, right ventricle, inferior left ventricle, 60% cases of SA node and 90% AV node. So that's an important point. That is the AV node, 90% of persons, it is the right coronary artery, and only 60%. So here you can see the synovial branch arising from the right coronary. Only in 60% SA node is supplied by the right coronary artery. The importance is that when patient has got a right coronary blockage, as in a right ventricular infarction, there is a high chance of development of AV block. That is the importance of remembering this. Now we go to the little more into the right coronary artery. You can see the right coronary artery here, as mentioned. This is the right coronary artery passing through the atrioventricular groove. It is going posteriorly, and passes in the interventricular groove, descends as the posterior descending artery. So here you can see it again. So hope this point is clear. As mentioned, left dominance, that is posterior descending artery arising from the circumflex, occurs only in 10% cases. 90% of the patients are right coronary dominance. Hope you understood this point. Now we go into the left coronary. The left coronary artery, the main stem immediately on origin, divides into the anterior descending, left anterior descending artery, and the other branch is the left circumflex artery. So the left anterior descending artery is called the widow's artery because blockage of this artery leads on to infarction of a major part of the heart for the left ventricle and leads on to death. And coronary disease is more common in males, and that is why this artery is called the widow's artery. So remember, left main artery, coronary artery or left main stem, divides into left anterior descending artery and left circumflex artery. The anterior descending artery supplies the anterior part of the septum, the anterior wall, lateral wall, and the apical left ventricle. So major part of the left ventricle is supplied by the left anterior descending artery. The left circumflex artery supplies the posterior and inferior part, the lateral, posterior and inferior part of the left ventricle. So details of this has been discussed in coronary circulation, another video. Those interested can see that video. So hope this point is clear. The basic thing you should remember is that there are two main arteries. The left coronary divides immediately into a left anterior descending and left circumflex, and that is why sometimes we call three vessel disease, because practically there are three vessels. Now we go into the next part, the basics of the conducting system. The impulses originate in the SA node here. Specialized system, the pathways, it activates the right ventricle and the left, not right ventricle, right atrium and the left atrium, and the impulse reaches the AV node. There is a delay in the AV node. From the AV node to the bundle of His, which divides in the right bundle and the left bundle. Left bundle divides into an anterior division and a posterior division, and from there, from the endocardium to epicardium, the depolarization goes. So this is the basic of conducting system. In order to identify and learn the various arrhythmias, you should be thorough with this pathway, and all of you should be able to draw this. That is originating from the SA node, activates the atria, right atria and left atria. There is a delay in the AV node. The bundle of His divides into the right bundle, left bundle. Left bundle has got two divisions. Now the basics of the physiology, that is the pressures in the, or normal pressures in the chamber. So then in various books there are differences in the values, but a simplified and easy way to remember, the right atrial pressure is 0 to 4. So remember 0 to 4, and it varies with the respiration, right atrial pressure. The left atrium is almost double, 8 to 10. So right atrium, here it is, take it as 4, left atrium it is 8. Then think about the right ventricle. Right ventricular pressure is the pressure inside the left, in the diastole it is the pressure in the right atrium, and in systole it is 25. So remember 4 and 25. You can easily remember that is the right atrial pressure is 0 to 4. So right ventricular pressure will be, in diastole it is 4 and in systole around 25. So once you remember these two, that is remember the pressure in the pulmonary artery. It is 25 in systole and 10 in diastole. So almost the diastolic pressure is almost at the pressure in the left atrial pressure. And the systolic pressure is almost the same as the pressure in the right ventricle. Now left ventricular pressure is easy to remember. Left ventricular pressure, you always will take it as 120 systolic, and the left atrial diastolic pressure is the pressure during diastole in the left ventricle. So left ventricular pressure is, you can take it as 10 millimeter, that is the pressure of the left atrium, and in systole it is 120, 10 and 120. So easy to remember. And aorta, simple to remember, 120 and 80. So this is a modified, easy to remember values, but various books there may be some differences. So fundamentally, right atrial pressure is 0 to 4, left atrium is double, around 4 to 8 to 10, and the right ventricle is the 4 diastolic and 25 systolic. Pulmonary artery, the systolic will be 25 and diastole will be 10. And the left ventricle, 10 in diastole and 120 in systole, and aortic pressure, easy to remember, the 80 to 120. Hope so. You should try to remember this, draw the picture and write down the values, and then only you can remember it. Now we go into few MCQs based on this. So simple questions. First is, which of the following chambers has thickest myocardium? Very simple. You know, left ventricle has got a thickness of 10 millimeters of that. So that, remember, when you draw the picture, you remember it is at 10 millimeter is the normal thickness of left ventricle. When it is thickened, it is called left ventricular hypertrophy. Next is, the AB node provides critical delay between atrial and ventricular contraction. What is the importance of the delay of impulse in the AB node? So the correct answer is you should note down the answer. So A, allow time for coronary perfusion. B, synchronize right and left atrial contraction. C, permit ventricular filling after atrial contraction. So remember, this is the conducting system. There is a SA node. There is a delay in the AV node. Bundle of his, the right bundle, left bundle, the left will divide into two divisions. So why there is a delay in the AV node? So the correct answer is, it permit ventricular filling after atrial contraction. So that is during the atrial depolarization, atrium is contracting, and atrium is contracting, and during that time the ventricle is in diastasis. That is, the ventricle is relaxing and getting time. So only if there is a delay in this impulse reaching the ventricle, then only the ventricle can completely accommodate the blood and start systole. So the correct answer is, permit ventricular filling after atrial contraction. This concept you should know. In 90% of people, the posterior descending artery arises from. So we have already mentioned that the artery that becomes the posterior descending artery or crossing the crux of the heart is the dominant artery. So what is the correct answer? We have already discussed the right coronary. In 90% of patients, the patient is right coronary dominant. Hope this is clear to you. So next is, which of the following structures forms the anterior surface of the heart? Of course, it is the right ventricle. So the anterior part, predominantly the right ventricle. RV lies anterior and forms the most anterior surface of the heart. Now which artery supplies AV node? It's an important concept. You should remember which artery. We have already mentioned that in around 90% the right coronary artery supplies the AV node. 60% of the cases the SA node is supplied by the right coronary. The clinical importance we have discussed that when the right coronary is blocked, that is in inferior wall myocardial infarction, there is a high chance of development of heart block. Hope this point is clear. A conical shaped nearly circular chamber in the cross section, that is when you take a cross section of the heart, so which is a chamber. So you can see the left ventricle has got the shape is conical, so it will be like this, and cross section it is circular, and the thickness we have already mentioned, it is around 10 millimeters. When it is high, it is called the hypertrophy. There are two types of hypertrophy. One is called the concentric hypertrophy and other is the eccentric hypertrophy. Concentric hypertrophy means the ventricle is thickened at the expense of the cavity. There is ventricular thickening occurring at the expense of the cavity. So there is not much cardiomegaly. The thickening occurs. This occurs usually in aortic stenosis and systemic hypertension. So concentric hypertrophy is at the expense of the cavity. Another is called the eccentric hypertrophy, where the ventricle is enlarging. This dilation occurring. Classical example is volume overload. Here it is pressure overload, and here it is volume overload. So volume overload. So what happens here? There is cardiomegaly. Classical example is volume overload is a mitral regurgitation and aortic regurgitation. Hope this point is clear to you. So we have mentioned about the hypertrophy. Now, next question is, what is the importance of annulus fibrosis? Annulus fibrosis is the electrical insulation between atria and ventricles. So this is a fibrous skeleton of the heart. So here you can see this is the annulus fibrosis. So this is a structural skeleton of the heart, and this is a barrier for the conduction of impulses. So that is the importance of the annulus fibrosis. So today we have discussed about the basic concepts you should have in, that is, we have discussed about the importance of coronary disease, mentioned few points on coronary circulation, the conducting system, the ventricular hypertrophy. In the next session we will continue with the other concepts in cardiology. Thank you.